This is Dr. Cohen. I'm here with Elizabeth. Elizabeth, unfortunately, fell and broke both of her wrists in the past week. And we determined that they both would benefit from doing surgical fixation, which involved opening up the wrist and putting in hardware. So this is the right wrist with the metal and screws in there. And then this is the left wrist with a very similar surgery, plate and screws holding the fractures together. Now, we did this surgery 24 hours ago. And can you tell me what pain medicines have you taken?
I took 2 extra strength Tylenol last night before I went to bed as a precaution.
Okay.
I still was not feeling any pain.
And what is your pain level today?
None.
Okay. Now,
0.
obviously you're doing great, easy hand range of motion. And let's see a little bit of wrist motion. Perfect. Okay, so what I'm trying to show you here, not every patient gets this fantastic of a pain response to the nerve blocks that we do, but the spectrum ranges from people who are, very uncomfortable after surgery to people who are not uncomfortable at all.
Right.
And more people are like this than in a lot of discomfort. And the other thing too, she's going to start therapy this morning. And we're going to get her some protective splints that she's only going to wear when she might fall. But other than that, she's good to go. And we are actually attempting to get her on a European cruise in the next 2 or 3 weeks. And based on what I'm seeing today, I think it's going to be doable.
Yay.
Yeah. So can you just add one other thing? What was your experience like with the surgery center, with me? How have things been?
Oh my gosh, everything from start to finish. The staff here are absolutely amazing. Kind, helpful, fun. Dr. Cohen is wonderful. He listens and is very thoughtful, pays attention, and wanted to know about me and what I needed to do. So I got lots of information, and the surgery went as well as he said it would. The staff at the surgical center were amazing. The anesthesiologist was a doll. He was so sweet. That was probably my biggest concern, but so good. And yeah, I came out and just kept falling asleep, recovering from the anesthesia. But everything else has been just fine. I actually put on my own makeup today.
Yeah, you're doing fantastic. And we will check in with you after Europe and see how you're doing.
Excellent.